Hi, everyone. I'm excited to be here, and the challenge of the 5 minutes was a fun one to try. So, my name is Lanie Francis. I am a medical oncologist and hematologist in Pittsburgh. I see patients with cancer and blood diseases, and I'm also the founder and director of our Wellness and Integrative Oncology program. Over the next 5 minutes, I hope to show you a very personal story behind a patient-centered technology tool. So the story, like all good stories as we know, starts with me. As a medical oncologist, I've always been very interested in the whole person, acknowledging the larger experience. And for me, that means thinking about the mental, physical, and spiritual health of my patients and their families as I treat and diagnose their cancer. When my mother was diagnosed with cancer, I saw the suffering in a whole new way for my family and for my mom. I saw the existential angst, the troubling side effects, the complex symptoms, all in a very raw, concrete, and profound way. Her illness and death changed me, and I realized that my position and perspective was powerful to create change, and I found myself charged with a new focus in my work as a medical oncologist. Around that same time, I discovered mindfulness for myself to deal with my own grief. I found that breath awareness, body awareness, visualization were very helpful to manage my sleep, my mood, and my overall quality of life. As many in this audience probably know, there is a robust body of evidence on mindfulness and meditation for chronic illness and cancer. And the challenge is not to convince patients of the evidence, but really to help them adopt this, to guide them, and to support them if they are trying to adopt mindfulness. Like a bicep muscle, starting a mindfulness process and a mindfulness practice requires consistent effort. And so for a moment, imagine that you're a cancer patient, and some of you may be, and you're engulfed in a storm, symptoms, logistics, information overload from well-intentioned friends and loved ones and your medical team. And that information overload can be mind-numbing. And the lack of control that most everyone feels in this setting is certainly not the best timing to adopt a new behavior, large or small. So I think we need better tools if we want to help patients adopt mindfulness and see the benefits. And those tools need to be in the right context, in the workflow of the physician for the handoff, and available and accessible to the patients. And that, of course, takes collaboration and multidisciplinary effort, as we're all talking about this weekend. So the story continues. Enter a man called Rohan Gunasalake. He focuses on mobile mindfulness, which means he sees mindfulness in the everyday and the layer and the textures of those everyday moments. He has multiple apps, but Buddhify is a popular one that I had used a lot in my experimentation with mindfulness. And so I essentially reached out to him and continued to kind of stalk him until he agreed to work with me on this project I had in mind. And so together we decided on goals, objectives, and vision. The clinical team was in Pittsburgh. Myself, our nursing team, patients, caregivers, and we worked on the content. And then he worked on the design and technology in Glasgow in the UK. And the result is Kara. So this is a set of guided meditations for patients with cancer. Kara stands for kindness, awareness, rest, and allowing, which are the platform pillar meditations promoting this philosophy of self-care. The other 8 are situational. I feel overwhelmed, I can't sleep, I feel like a burden, describing common challenges for patients with cancer. You click on any meditation, you can listen to it through the headphones or the speaker. The content is excellent. Patients can listen to it when they're waiting for scans, waiting for their appointments, in the comfort of their own home, before they're trying to sleep. It is a free mobile website, and those were decisions that were very intentionally patient-centered. There's a section for reflections, promoting some of the basic principles of mindfulness and the challenges of cancer. There's ways to share stories and, of course, ways to share feedback. So thank you for giving me this opportunity to talk about this. If you have questions or support, please reach out to me. Thank you.